Welcome to my channel, Kidney Health with Dr. Ali. Today, we are going to talk about early signs you should never ignore. Did you know that over 850 million people worldwide have kidney disease, and most of them have no idea? That is right. Your kidneys could be struggling right now, and your body might already be sending you warning signals. The problem? Most people mistake these signs for something else entirely. In this video, we're going to walk you through the early warning signs of kidney disease explained in plain, simple language, no medical jargon. No complicated terms. Stay until the end, because sign number 7 shocks almost everyone before we get into the warning signs. Let's take a quick look to understand what your kidneys are actually doing inside your body. Because once you get this, everything else is going to make a lot more sense. Your kidneys are two small bean-shaped organs. Each one is the size of your fist, and they are sitting just below your rib cage, one on each side of your spine. Now, every single day they are filtering around 200 liters of blood. That is about 50 gallons. They are pulling out waste, flushing out toxins, and turning all of that into urine. But here is the thing. That is not even all they are doing. Your kidneys are also controlling your blood pressure, keeping your bones strong by activating vitamin D, helping your body produce red blood cells, and balancing important minerals like sodium, potassium, and calcium. So, when your kidneys start struggling, all those functions start to break down too. And that is exactly why the warning signs can show up anywhere in your body. Alright. Let's go through the 10 early signs now. Just to be clear, having one of these does not automatically mean something is wrong. But if several of these sound familiar, that is your time to talk to your doctor. Sign number 1 is changes in urination. And this one makes a lot of sense. When you think about it, your kidneys are the ones making urine, so any shift in your bathroom habits is worth paying attention to. What you are looking for is peeing way more than usual, especially in the middle of the night, or going less than normal. If your urine looks foamy or bubbly, that can be a sign that protein is leaking through your kidneys. Or if the urine is coming out dark brown like Pepsi Cola, that could mean there is blood or waste building up in there. Think of it this way. Your kidneys are like a water filtration system. When the filter is clogged, what comes out is going to look different. Sign number 2 is swelling in your hands, your feet, or your face. Here is what is happening. Healthy kidneys are constantly removing excess fluid and sodium from your body. When they can't do that job properly anymore, that fluid has nowhere to go, so it starts building up. The most usual places you'll notice it are your ankles and feet, especially after you've been on your feet for a while. Your hands and fingers, maybe your rings, are suddenly feeling tight when they never did before, and your face, especially around your eyes when you wake up in the morning. Doctors call this edema. It is your body holding onto water that it simply cannot get rid of. Sign number 3 is extreme fatigue and weakness, and this one is easy to brush off or blame on other things. So, here is what is actually going on. When the kidneys are damaged, they start producing less of a hormone called erythropoietin. That hormone is what signals your body to make red blood cells. And when there are fewer red blood cells, less oxygen is getting to your muscles and your brain. The result is that you are feeling completely wiped out, even after a full night of sleep. You feel weak, you can't concentrate, and you haven't even done anything physically demanding. A lot of people chalk this up to depression, or burnout, or just getting older. But it could be your kidneys. Sign number 4 is skin rashes and itching. And this one genuinely surprises people. When your kidneys are not filtering waste properly, those waste products start building up in your blood, and those toxins. They end up irritating your skin from the inside out. The itching that comes with kidney problems is usually widespread. It is not sitting in one spot like a bug bite or a rash. It tends to get worse at night. And no matter what cream or antihistamine you try, it just does not go away. If you've been through every lotion on the shelf and nothing is working, it might be time to get your kidneys checked. Sign number 5 is high blood pressure that just will not come down. And this one is a bit of a tricky cycle. Your kidneys are part of what regulates your blood pressure. They control fluid levels and produce certain hormones that keep things in balance. So, when they're damaged, blood pressure goes up. And when blood pressure stays high for too long, it causes even more damage to the kidneys. It feeds itself. The dangerous part is that high blood pressure often has no symptoms. It is called the silent killer because it is quietly doing damage while you feel completely fine. If your blood pressure is consistently running above 130/80, ask your doctor to check your kidneys at the same time. Sign number 6 is nausea, vomiting, and loss of appetite. When waste products start building up in your blood, the doctors call this uremia, and it can make you feel constantly sick to your stomach. You might be feeling nauseous for no obvious reason. You're vomiting, especially in the mornings. Food just does not sound appealing anymore. And over time, that leads to unintended weight loss, which is another red flag on its own.
A lot of people assume it is a stomach issue or food sensitivity. But if it keeps coming back and there is no clear explanation, do not just ignore it.
Sign number 7 is a metallic taste in your mouth or an ammonia-like smell on your breath. And yes, this one is as strange as it sounds. Here is what is happening. There is a waste product called urea that your kidneys are supposed to be removing from your blood. When it starts building up, it can break down in your saliva and produce ammonia. That creates a metallic or ammonia-like taste that just sits in your mouth. Some people also notice that their breath smells like ammonia, even right after brushing their teeth. This is called uremic fetor. So, if food is suddenly tasting like metal or people close to you are commenting on your breath even though your hygiene is fine, then your kidneys might be the reason. Sign number 8 is shortness of breath. Not after a workout, we are talking about climbing a flight of stairs or just walking to the mailbox and feeling out of breath. Kidney disease is causing this in 2 diverse ways. First, when your kidneys cannot remove excess fluid, it starts building up in the lungs, and that makes it genuinely hard to breathe. Secondly, because of anemia, that low red blood cell count we talked about, your body is just not getting enough oxygen circulating. Sign number 9 is muscle cramps and restless legs. Your kidneys are responsible for keeping your blood minerals in balance, like sodium, potassium, calcium, and phosphorus. When that balance is thrown off, your muscles start to feel it. You might be getting painful cramps in your legs, especially at night. Maybe you are dealing with restless leg syndrome, which is a constant urge to move your legs that just won't let you sleep. Or you are noticing muscle twitching and weakness throughout the day. These are easy to write off as dehydration or just aging. And sometimes that is all it is. But if the cramps are frequent and severe with no good explanation, then it is worth digging a little deeper. And sign number 10 is difficulty in concentration and a foggy brain. Because kidney disease does not just affect your body, it affects your mind too. When toxins are building up in your blood and your brain is not getting enough oxygen because of anemia, your thinking starts to slow down. You are having trouble focusing on simple things. You are forgetting things you normally wouldn't. You feel mentally sluggish and may even be confused. People blame stress, they blame age. But if that foggy feeling is coming along with several of the other signs on this list, take it seriously. Now that you know the signs, let us talk about who is most at risk. You are at higher risk if you have diabetes, and that is the #1 cause of kidney disease worldwide. High blood pressure is number 2. The family history of kidney problems is another big one. Obesity, being over the age of 60, or using painkillers like ibuprofen. All of these are factors that put more strain on your kidneys. And here is the good news. When kidney disease is caught early, it can often be slowed down or even stopped from getting worse. So, if you recognized a couple of those signs in yourself or in someone you love, here is exactly what to do. First of all, do not panic. These signs do not automatically mean kidney disease, but they do mean you should get checked. Second, see your doctor and ask for 2 specific tests. One is a blood test called eGFR, which stands for estimated glomerular filtration rate. The other is a urine test called ACR, albumin to creatinine ratio. These are simple, straightforward tests that can tell you a lot. And third, start protecting your kidneys right now. Drinking enough water every day, 6 to 8 glasses, is a good target. Cut back on salt and processed foods. Keep your blood sugar and blood pressure under control. Avoid overusing painkillers. And if you are in a higher risk group, make regular checkups a habit. Your kidneys are working hard for you every single day silently, without complaint, without asking for anything in return. The very least we can do is to pay attention when they are trying to tell us that something is wrong. If this video helped you, like and share it. It could save someone's life. Subscribe and hit the bell so you never miss a health video. Comment below. Which sign surprised you the most?